Ryan and the HitLab team. It's a real pleasure being here. I was here about 5-6 months ago, and it's always just incredible to see the kind of environment and the kind of connections that are made at HitLab. So really lovely place. One also update is I'm actually no longer the medical director of the Digital Innovation Hub. I used to. I did that for about 10 years, innovation and informatics at the Brigham. And now I'm kind of in between opportunities until my next thing in early next year when it starts. That being said, for the last kind of decade of my career, I've really focused on a lot of digital health and emerging technologies in healthcare. And two of those, as you mentioned, generative AI and extended reality, are incredibly exciting. But not only, those two aren't the only kind of fields that I think will evolve over the next kind of decades to become more prominent. You know, if we think about it, we are at the very beginning of the 21st century. And it's kind of crazy to think that the fields that we see as kind of these pillars of medicine, like family practice, internal medicine, that they're not going to evolve. And clearly in the 21st century, things like emerging technologies, emerging kind of societal kind of norms and other pressures will kind of define the future specialties of the 21st century. And to me, things like extended reality, artificial intelligence, those are clearly going to be the new fields for the 21st century. But there'll be others, things like climate health, things like psychedelic medicine, things like, eventually, interstellar medicine, space medicine. These are going to be the new fields of the future, and we have to kind of work together and start building these foundations to kind of support them.
What have you seen that has been the biggest change or advancement or difference from the last time you spoke in June? Has there been any recent breakthrough, or has your opinion or thought been changed in the time since you last spoke?
You know, what I think I've seen in the last 6 months has been, instead of just talk, actual kind of work happening in both the generative AI side and also, frankly, in the extended reality side. You know, 6 months is not very long in medicine. You know, that's like a blink, a drop in the bucket. But even since then, I think we're starting to see real kind of use cases, pilots of kind of ambient technology in healthcare. So I know my organization and many other organizations are very excited about the opportunities that generative AI can kind of pose for healthcare. So specifically, what are the things that not just my organization, but many organizations are looking at? Well, one is the concept of an ambient scribe. So the idea of, you know, when I started practicing medicine, I learned on pen and paper. So you had to like write out a full H&P, and I feel like that definitely dates me, but you got really good at it, right? And there was like a skill in being able to do a very concise history and physical that fit in like kind of more or less one page, right? And you would put your past medical history and medications on the side. Everyone had a different style. And as I kind of went through my training, I actually saw these big leaps. So computer physician order entry, right? And the rise of the electronic health record. And then eventually, the kind of dominance of some major EMRs, particularly if you're in a large academic or a large health system, kind of becoming the focus of your clinical work. And the way you actually kind of document has also evolved. So from pen and paper, I remember being a resident and having my first dictation tool, a computer-assisted dictation tool. Before that, we would actually call a number, and someone would actually dictate the H&P, and it would be like 4 or 5 hours, and you would actually get a printout of your actual kind of H&P. So when I was a resident, I got Dragon dictation for the first time. And this was like kind of early. You still had to baby it. It was pretty good, but it was like about probably 60, 70% good. As time has moved on, now I still use Dragon dictation for dictation. And it's so good that I can basically eat lunch while dictating, and it's going to get it like 99% of the time. It's pretty incredible. I can't like, when Dragon is down, or any dictation tool, it's not just Dragon, it really affects my quality of life when I clinically work, because I'm so dependent on that to like just bang out my notes. The next leap I think we're all hopeful for is, instead of kind of dictating your notes, just having an ambient scribe. So using the power of these generative AI, LLM kind of solutions to enable just an ambient kind of listener on your phone, on a device, on a computer in the room, that can actually listen to the encounter and then summarize it, come up with a plan. And what's really exciting about this is that, I've used these tools, and they really, really work. They're not perfect. They're still being kind of, I would say there's still room for improvement. But you see this critical path where that is going to be the next jump. Instead of actually being behind a computer while you're seeing the patient, everyone's probably seen one of those like cartoon memes or pictures of like the doctor, with their back towards the patient on a computer. What generative AI and ambient scribes have enabled is just having an actual conversation where the actual documentation is no longer the primary thing that you're having to juggle while you're seeing the patient. And there's something real about having that eye contact, like talking with the patient and listening, and having the patient actually see that you're listening. It's kind of incredible. We're using that now. And I would imagine that in the next 6 months to a year, we'll start seeing more and more kind of spread of these tools. And it's not just for ambient scribes. So LLMs and ChatGPT-like kind of tools are also being explored to help kind of auto-generate replies for inbox messages, or help triage back of the house kind of operations. And there's so many other potential opportunities for these tools, especially as they become more kind of integrated into our existing health records. The other part of this, I'll say, is that we also have to be kind of thoughtful about how we implement, right? We're all very hopeful, but we also have to be fairly kind of considerate about how we do this, because we need to make sure that these things are safe, they're secure, and they actually work as intended. So there's this like kind of tension as we think about it.
Yeah, I was going to touch on that. We can talk about your work-life balance later. Hopefully we can get some ambient scribe going so you can just eat lunch and not have to eat lunch and do your notes.
Yeah.
But how do you be careful of those ethical considerations and making sure that you're thinking proactively like you are? But what are some of the steps that you can take, or ways that you can ensure that all of these tools are implemented in a way that you're seeing the value without the risks or concern that it might be producing something that isn't as necessary as your medical opinion or things of that nature?
Right. I think nothing is 100%. There are no panaceas in medicine. If anyone is selling you a panacea, it's likely snake oil. And that's the same with these emerging technologies. So I think the sooner we can all kind of come into these tools with eyes open and understand the limitations, and frankly look for the limitations, but not throw out kind of the technology or the opportunity just because of the current limitations, that's what we have to do. So, I know globally, as we all think about these, particularly as we're, at probably the very peaks, or maybe starting to go down on the hype of these tools, we have to balance that and just be really thoughtful about how these things are rolled out, how they're tested. As we've thought about this, and by we I mean the folks at my system, we've really considered very, very thoughtful kind of small rollouts, pilots, and I think many other organizations are doing similar things, to just see, like, does this work? Do clinicians actually find it helpful? Do clinicians actually find that it saves time? And are the notes like up to spec, right? And I think we're all kind of learning as we go before we do any kind of mass rollout.
Yeah, it's definitely a trust factor too.
There's a trust factor.
You want to know that the tool you're using is accurate to the degree it can be and is going to be helpful.
That's right. And in some ways, the other piece of this is, you kind of don't know all the ramifications of like any kind of intervention until you kind of see it kind of live, right? I mean, The concept of the copy note forward, which is like prevalent in healthcare, that was one of the like unintended consequences of like our current state of EHRs, right? And it's going to be interesting to see what happens in this brave new world.
Yeah, and lastly, I just want to talk a little bit about the interdisciplinary nature of these technologies and talk a little bit about collaboration, working with technology experts and medical professionals, and how can you facilitate the better integration of these for mutual benefit?
Yeah, absolutely. I think a lot of these emerging technologies, they can only happen when you work across kind of disciplines, when you work across specialties, when the technologists, the clinicians, the payer providers all get together to kind of come up with aligned goals and benefits and work and just kind of move forward. So, one of the kind of emerging technologies that I'm like very biased on, I was talking about, in fact, 5-6 months ago when I was here, I think I had just like kind of, I was still in my formal kind of announcement phase, is I started a medical society dedicated to extended reality, the American Medical Extended Reality Association. And that, by its kind of defining mission and kind of who we are by nature an interdisciplinary, interprofessional medical society to build out this future. I am convinced that this technology is going to be fundamental to both healthcare, but also just kind of society as a whole, extended reality. And in order to kind of help push it forward and move it along, well, what do you need to create a new field of medicine, a new specialty? Well, you need a society, you need a journal. So now we have the Journal of Medical Extended Reality. So that's another tangible thing that we've created, and we have our first kind of publications slated for January. And eventually, you need a symposium. So that's kind of what we're kind of moving towards as we build out these new kind of pillars. And it has to be done interdisciplinary. So American Medical Extended Reality Association has, of course, physicians, of course, nurses, but also technologists, entrepreneurs. We have folks in government. We have folks who are leaders inside of kind of some of the largest medical extended reality companies as members, because we're all aligned on kind of this core vision of creating this new field of medicine. We have 3 core initiatives at AMXRA: creating the professional home, educating about MXR to the public, our professional colleagues, and also our regulators, eventually our regulators. And also it's advancing the science. So that's how we're doing it. We're aligning on those things across the board and kind of moving forward. So it's absolutely critical.
Thank you. That's just wonderful. Always good to chat with you. The technology is fascinating. I encourage everyone to engage with you and learn more. And hopefully we'll have you back next year and you can tell us about your new endeavor.
It's always a pleasure. It's always a pleasure. Thank you all.
Thank you.
Yeah.